Hello, my name is Kim and I'll be your Pilates instructor today. As an experienced physiotherapist, I can take you through safe and effective exercise. If you do feel pain, discomfort, shortness of breath, dizziness, or any concern about your vascular access, then please stop and seek advice. Otherwise, relax and enjoy the movement. If at any time you feel concerned, you can just sit down, relax, find a comfortable position, breathe, and just take yourself through the exercises that I'm describing in your mind. This can have enormous benefit. Now, it's very normal to adopt shallow breathing when you're experiencing pain and discomfort, quite often breathing into the tops of your lungs and not expanding down into the bottom of your lungs. Now, we all know that good controlled breathing can be very calming and very good for your health. So I'm going to take you through some Pilates today that will help you to control your breathing and also take you through some standard exercises, nice and gentle, to adopt the breathing alongside movement, which is very important. So we're going to start off here in standing. Have a chair close by. If you feel at any time you need to get hold of it, then use it for your balance just next to you there. We're going to get into a good posture to start with. Feet hip width apart, toes pointing forwards. Soften through your knees, tuck your bottom under. Do not overuse your abdominal muscles here, just gently squeezing to tuck your bottom under, keeping the ribs down, the chest nice and open. Feel the shoulder blades a little drawing down the chest wall at the back by just pushing the shoulders down here. Tuck the chin and lengthen the back of the neck. Now, just in this posture, we're going to do a few nice gentle breaths. Bring your hands onto the outside of the rib cage as long as that position feels comfortable. If not, just hang your arms down by your sides. Be careful of any of the vascular access through this arm. Good. So we're going to breathe in through our nose, expanding the rib cage here, breathing out through the mouth. You can actually push into your ribs a little bit there as you come and breathe out. Keep that pressure on as you breathe in. And so you feel the resistance of your hands against your ribs. Breathing out and just pushing gently into them. Good, breathing in, into that slight resistance of the hands. Breathing out. One more time, take it at your own speed. Breathing in and breathing out. Lovely. We're going to do quite a lot of breathing in this workout. So if you do feel a little bit dizzy at any point, just relax, find a comfortable position and use your own methods to recover. Okay, so we're going to have the hands on the hips here. We're going to take the weight onto your right leg. Follow me as a mirror. Pick up the left up in front of you. Take the weight down onto your left and pick up your right. This is the time you may need that chair next to you, so fingertips on the chair if you feel a little bit vulnerable. Okay, so now we're going to add the breathing. Breathing in through your nose. Breathe out as you lift. Breathing in and breathe out again, okay? Breathe in through your nose, breathe out as you lift. Breathe in as you lower, breathe out to recover. So it does get a little complicated adding these breaths to the movement, but just center yourself, relax, and as long as you're getting the breath down into your ribs, then that's good. Breathe in to prepare. Breathe out as you lift. Breathe in as you lower. Breathe out to recover. Breathe in. Breathe out. Breathe in. Breathe out to recover. Lovely. All right, so we're going to do some rotations of the chest with this breathing, okay? I'd like you to step your legs out wide. We're going to bend the knees a little. So it's like a sumo stance. Bring your arms in front of you, palms together. Breathe in to prepare. Breathe out as you rotate. Breathe in as you come back to the front. Breathe out as you rotate. Breathe in. At your own speed, remember, breathe out. Just be careful of that arm, that vascular access. Make sure you're not putting it under too much stress. And make sure those breaths are not too deep. Breathing in, breathing out, nice and relaxed. Breathe in and breathe out. Lovely. Bring the arms back down and step your legs back in. Let's assume that good posture again, whilst recovering from all of those deep breaths. Bend your knees slightly, tuck your bottom under, ribs down, chest open, and I'm just going to get you to bring your hands behind your head. Interlock your fingers, have your elbows wide and your shoulders down. I'd like you to breathe in as the elbows are open. That really encourages air into the bottom of the lungs. Breathe out as you close down, stretch the neck, and breathe in and open again. Just take a second to recognize this could put some extra pressure on that arm. Breathe in, breathe out, make sure everything feels fine. Breathe in and open, reduce the movements if it feels a little much. Breathe out. One more. Breathing in and breathing out. Lovely. Bringing the arms down and just roll the shoulders. We're going to be coming down onto the mat now, so I'd like you to stand on the end of the mat if you feel comfortable enough to. Now these transitions can put a little bit of extra strain on the body, so if you need the chair to lower yourself down in your own time, then do so. If you feel okay bending forwards, I'll demonstrate that side. Breathe in. As you breathe out, drop the chin and curling down. Good, let's not stay here for long. And bend the knees, sit on your heels. Just be careful of anything around your abdomen. And we're going to come onto the hands and knees. Good. Step those hands forwards if you feel vulnerable through your arm, or come down onto the elbows. This is all just fine. Lovely. Pull the shoulders down away from the ears, tuck the chin, knees underneath hips. Lovely. We're going to do a cat and cow. So we're going to curl up with a breath in. And we're going to curl down as we breathe out. Now, these can be the opposite. You could breathe in here, and you could breathe out. If I'm really honest, both restrict the breathing, so it's good practice. Good, breathing in through the nose. Breathe out. Breathing in, and breathe out. Good, breathe in and breathe out. Good. As long as your abdominal area feels safe to do so, we're going to drop forwards into a cobra position here. And we can take a nice deep breath in and breathe out and come back into a child pose. Now both of these positions can put pressure on vascular access through the arm or through the peritoneum. So it is important, maybe, that you do just a nice, gentle version. You can just move nice and slow. But if you are able to do the full movement, remember to take the breath, breathing in and breathing out as you come down and back. Good. Take a breath in as you come forwards. Breathe out as you come down and back. Lovely. Coming back onto the hands and knees, we're going to do a thread the needle exercise. Now this could put some extra pressure on your arms, so if you are struggling with this, all the weight bearing through the wrists, let's have the hands across the chest here. Just kneeling. You can do some rotational exercises there. Otherwise, this is our thread the needle. We're going to breathe in as you bring the arm up and breathe out as you're squishing the air out of the lungs and pushing through. Breathing in again and breathe out as you come through. Take your time, go at your own speed. Add a few gentle breaths in between. Take the breaths nice and shallow. We certainly don't want to be feeling dizzy at any point. Good. Swap arms. Take the weight onto that weight-bearing arm. Squeeze through your tummy to make sure you're stable. Stretching up, breathing in and breathe out. We're not looking at the breaths being too deep. They're just controlled, breathing in through your nose, relaxing the air out through your mouth. Good, I think we have one more. Lovely. Let's come around onto our backs, adopting our Pilates positioning. So take your time getting there. Always important to move at your own speed, transitioning through these positions, and do it however makes you feel safe to do so. So, once we're here, I'm going to tuck through the chin, broaden out through the chest. Take a nice breath in through your nose, breathe out and sink those ribs down. That's lovely to do with the breath. In fact, let's do that one more time, breathing in. And breathe out and sink those ribs down. Bring the hands to the hips here and rock back and forth. This will pull your head and the rest of your body up and down the mat. That means that you're tilting your pelvis correctly. Settle in a good neutral position there. Tighten through the pelvic floor. And if you've got your positioning and the tightening of the correct muscles, then you will feel that you can breathe unencumbered. It won't be affecting what you're doing around the middle, and also the other way around. The tightening of this will not affect your breathing. If it feels comfortable to do so, bring your hands onto your ribs here, spread your fingers and hook your thumbs around the back. We're going to take a nice breath in. From here, we have the pelvic floor tightened, deep abdominals switched on. Breathing in through the nose, feel those ribs expand. Breathe out through your mouth and add a little pressure in. Keep that pressure on as you start to breathe in. Wonderful, that triggers a nice deep breath, and breathe out. But do be careful for these breaths not to be too deep. Good, and breathe out. Nice and controlled, not forced. Breathing in through your nose, out through your mouth. And one more, breathing in and breathing out. Nice and relaxed. Lovely. One more exercise to do with the breath. I'm going to turn onto the side here. You can support your head with your arm, or a pillow, or a Pilates block, or yoga block would be perfect. Both hands out in front of you. Make sure you take care to position your arm, especially with the vascular access. Make sure that's safe. Both hands together, tuck the bottom hip back. We're going to take a breath in as we reach up. Breathe out as we reach over. Good. Breathe in and breathe out again. Now this is a lot of breath, so we need to take it nice and slow so we're not hyperventilating. Breathe in as you stretch up. Breathe out as you stretch over. Breathe in. Breathe out. Now you can always bend this arm. You can breathe in as you take the arm up. You can just bend the arm as you come back and over if it's a bit too much pressure. Breathe in and breathe out. We're going to turn onto the other side to demonstrate that. You may roll over if you prefer, but take your time, turning over, head onto the pillow, hands out in front. Take care with any vascular access you have there. Make sure it's all safe. Position everything correctly. Hips one stacked on top of the other. Breathing in, stretching up. Breathing out and over. Good. Make sure those breaths aren't too deep. Take care of the arms at all times. Breathing in, breathing out. Bend at the elbow if you need to. Good. Breathing in, stretching up. Breathing out and over. Lovely. All right, so from here we're going to come back up into standing. I want you to recognize if you're feeling a little dizzy already and take your time coming up, or lie down and listen to the rest of the video in a relaxed position, just getting everything back to normal. So standing up, let's use the chair to get up. One hand on, step one leg forwards and bring yourself up into standing. Okay, so lovely. Let's reset our posture with the intention of holding it there for the rest of the day. Feet hip width, soften those knees, scoop and tuck under, ribs down, chest open, chin tucked, and a couple of breaths to finish off. Just breathing in, lift the shoulders, breathe out and drop. Breathe in, lift the shoulders, breathe out and drop. Lovely. So I hope I've drawn your attention to the breath today. It's very important to carry that through the rest of the day and the rest of your Pilates practice and exercise. A few controlled breaths, drawing your attention to them, can calm your mind and your body. So take care, guys, and I'll see you on our next session.